Welcome back to the podcast. So if you're new to the channel, then like and subscribe and check out our other videos. But today we have a great topic and it's all about morning erections. And Faraday and I are going to cover, specific points. And is it normal to have a morning erection or is it normal to not have a morning erection?
Yep. This topic came around because of you guys, your comments from another one of our podcasts that regarding morning erections. So definitely leave your comments. We do read them and we will bring up topics that you guys ask about. So let's start with morning erections. Are they normal?
Are they normal? So why does that happen? So the very simple answer to that question is really testosterone rise in the morning. Yeah. So testosterone goes highest in the morning, and that is enough without any kind of arousal to cause an erection. And that's the simple answer, right?
That's the simple. Then we get a little bit more in depth and we talk about the parasympathetic nervous system and then about how nerves are affected, like the sacral nerve, and about sleep and Rem sleep specifically.
Yeah. Well, if you want to talk more about the parasympathetic nervous system, then we'll start there.
So that is very active while the body is at rest. So when we sleep, the body is working to repair itself from the day to kind of reset. So it is also responsible for sexual arousal in the body. The sacral nerve is part of the parasympathetic nervous system as well, which is responsible for erections. And erections happen at all ages because of that. Morning erections are a sign of a good, healthy blood flow and parasympathetic nervous system.
And if you think about sympathetic, parasympathetic, sympathetic is your fight and flight, so everything constricts to certain organs so that your heart is going, your muscles are going because you're really trying to get out of something scary. Parasympathetic is the opposite. And so basically blood flow can increase to those non-essential organs that aren't going to get you out of something. And you're not thinking about sex when you're thinking about survival. And so parasympathetic, so it just makes sense that that opposite nervous system is more active when you're, getting better blood flow to an organ that is essential for sex. So and repair. And when it comes to sleep, again, that parasympathetic nervous system takes over, and especially in REM sleep. And REM is crucial to erections, nocturnal and morning erections.
And that was something we did not realize played such a huge role in erections throughout the night, not just the morning. Guys, you just notice them in the morning because you're awake. But erections happen multiple times throughout the night without you even being aware. And that is normal as well. Yeah.
There was actually, going back to we had a sexual response podcast way back. And if you haven't listened to it, you need to go back and listen to it because it gives a history of some research done, which was very interesting. And this kind of brought up just at least one study in 1987 in Korea, again, where they were kind of studying those nocturnal erections with rigidity and how many times they had them and what the blood flow and nervous system looked like then. But again, it is normal throughout the night. You just don't know it. But it also goes back to that procreation, REM sleep, you get erections after that. It's kind of related to REM and deeper sleep and dreaming, and then your parasympathetic nervous system takes over, and those morning erections happen after a REM cycle, which goes 4 or 5 times a night sometimes. And so that was basically almost for procreation, like maybe having sex in the middle of the night or first thing in the morning was just a natural kind of evolutionary thing that we learned while we were preparing for the podcast. But so how do you know that you're getting REM sleep? What are some things that you will see with REM sleep?
There's definitely things that we can do to improve REM sleep, like having a sleep schedule, being well hydrated, getting regular exercise. These are things that are very common, everyday, kind of common sense stuff that we just kind of have to remind everybody. Using blue light glasses. We are so overwhelmed these days with our monitors and our screens between our phones and our computers and our laptops and at work. Everywhere we go, there is blue light, kind of surrounding us now. We just can't really avoid it unless you do something that Unless you're off the grid, I guess. If you're off the
Yeah.
grid, you're not worrying about blue light, but then you're not listening to the podcast either.
And I think simple stuff, even if you didn't get like glasses that limit that blue light exposure, is really turning off your phone, not being stimulated right before sleep with something that is, tech related, essentially. Get a book. That's an easy way to fall asleep without that
old school
light and stimulation, because that will decrease your REM sleep once you get to sleep.
Yeah, so just a healthy sleep cycle or schedule, consistency, going to bed every night at the same time, trying to wake up even on your days off, waking up consistently at the same time. That can play a huge role.
Healthy, so basically if you're thinking nutrition, decrease sugar, decreased eating before bedtime, because that will increase cortisol, which interferes with your REM sleep as well. And hydration, decreased alcohol. So medications too, sleep aids at night will decrease your REM sleep.
So avoiding before bed, alcohol, marijuana, sleep aids, caffeine, and cigarettes, all stimulants that can negatively affect REM sleep. All the vices.
Yes. And when you look at sleep, again, we are awake. We're, in a light sleep maybe, but with deep sleep, we're talking about non-REM and REM, and most of it is spent in non-REM, about 75% of it, and 25% in REM. You'll have rapid eye movements, some involuntary movements, dreaming. So if you're dreaming, then you've had that REM sleep, but it should be at least 25%. You're a little more difficult to arouse during that. You will wake spontaneously in the morning. That's a good, post REM. Your brain's active during REM sleep.
And what most people don't realize is that we go through these cycles multiple times throughout the night. It is not a bell curve where we're in light sleep, deep sleep, light sleep, wake up. We are in and out of REM and light sleep in moments of wakefulness all night long.
So, and therefore, the more REM sleep that you have in those cycles, those are the erections. So you want REM sleep. So however you can increase your REM sleep, and again, healthy habits and healthy exposure prior to bed is key. And then, not taking any substances like we talked about. And again, is it normal to not have morning erections or nocturnal erections? And so the simple answer to that would be no.
We should be. Now, why does it happen? Why do we not see these morning erections as we age? For men is because of other issues like poor blood flow, hormonal decline, specifically in testosterone, vascular issues, diminished neurological function. So there are things that can negatively affect it as we age. But the simple answer is it's not normal. It should be occurring.
You should have nocturnal and you should have morning erections. It's not normal to not have that. And then, as Faraday says, there's lots of different reasons from a physiologic standpoint that we can correct and address. But from what can you do to help that? Well, you need to increase your REM sleep. So think about those things, because that decreases with age as well. So if you're now taking sleep aids at night, or you're drinking alcohol and you didn't before, those little things can help you increase your REM sleep again, along with, again, optimizing all those other things, hormones and blood flow and regeneration, because that matters, and those things change too as you age. So,
and now, as we've talked about all the technology, there is so much out there to help track sleep. There are lots of products out there. I have a favorite, but they help. And they made a huge difference in how my sleep schedule changed just by tracking my sleep and looking at it and seeing what affects it, and really kind of seeing consistency. And then a lot of your recovery the next day and how you feel the next day depends a lot on how much of that REM sleep you got and how good of sleep performance or quality you got the night before. So it's even beyond the erections. It's our energy, it's our focus, it's everything, our brain fog, it's everything else that next day as well that plays a huge role in our recovery.
Men, if you look at like sleep over time with some studies, like men tend to have trouble staying asleep, and they do less REM cycles usually than women. I just think women probably don't know because we don't have that,
that's surprising considering we go through perimenopause and menopause, and but that's hormonal, that's progesterone.
Well, but it's more trouble falling asleep. And so it was like women, with those, studies that I looked at, it was trouble falling asleep. With men, it was like staying asleep. At least that was like what was looked at, and discovered. But anyhow, I didn't know that. But I think that women definitely, have issues falling asleep, and I feel like even staying asleep, really. But I think that happens with age and hormonal decline and testosterone decline in both as well, because that helps us sleep. So hopefully that helps. And there is an increase in testosterone in the morning. And so that is actually why, there's an increase in heart attacks between that 6 to 8 a.m. is an increase in testosterone, sexual activity sometimes. So it's interesting to see the physiologic effects of hormonal changes. The other thing that I would bring up is sleep apnea becomes a little more common as we age. And the only treatment really is
a CPAP.
Yeah, a CPAP, which is not very conducive to sleep. So there is a laser treatment. And if you haven't checked out our video on night lace, there's a laser treatment that can be done potentially to help decrease that redundancy and tighten up the back of the throat and the posterior pharynx, to help with snoring and sleep apnea with pretty beneficial results. So
absolutely
check out that. It's called Night Lace. And if you haven't seen that YouTube video, then please do.
I think we'd be remiss to say, obviously, lifestyle changes too with sleep apnea. We tend to see it with changes as we age, with weight gain. So healthy lifestyle, exercising regularly, things like that can help. But medically, we put people on a CPAP.
Yeah, I think that there's still, a subsegment of patients that are fit and healthy and still have snoring and sleep apnea issues. So that is one way to treat it, because I don't feel like the CPAP is very conducive to sleep if you're having issues with that. So
yes.
So hopefully this helps. Morning erections are normal. Nocturnal erections are normal. And so if you have a decrease in those, these are some ways that you can increase your REM sleep and those erections again. And then there's some regenerative stuff we can do as well. So hopefully this helps. Let us know what else you want to hear about, because we're willing to deep dive into anything sexual wellness and wellness. Thank you.